It is a responsibility of all of us in this country to support, protect our breastfeeding mothers, and this can only be done if we all unite and we look at our infants in this country as an investment as a nation. Because if we breastfeed today, it means that in the next 20 or 30 years, the prevalence of the non-communicable disease is going to go down. Studies have shown that well-breastfed infants have a lower capability of acquiring the non-communicable diseases. Therefore, it is important for all of us to ensure that we support our breastfeeding mothers. We enforce the acts of parliament that are in place, for example, the Health Act, which provides Article 71 and 72, which provides for the provision of a lactation space, and the equipping of the same facility is enforced both in the private and in government health facilities, and also in all places where we have employees. The employers should provide that as per the law. It is important also to ensure that we also comply with the Employment Act, whereby we are supposed to give the breastfeeding mothers the maternity leave and the paternity leave, so that we also support. There is also the support of the father in breastfeeding. Therefore, it is very important, and I need to encourage our breastfeeding mothers and all of us as a nation to ensure that we protect them in the fact that infants should be breastfed anywhere. If you look at any individual when they are traveling or whenever they are in this country, they are supposed to eat as they need. Therefore, even the infants, we should ensure that breastfeeding mothers are allowed to breastfeed their infants as and is available, and when the mothers can, because it is very important for us to protect them. Progressive studies have shown that infants who are well breastfed, they don't get non-communicable diseases, the likes of diabetes, hypertension, certain types of cancers, and therefore ensuring that we breastfeed for the infants and also for the mothers. It's important also to remember that when we breastfeed our infants, exclusively breastfeed our infants for 6 months, then it means that the bond between the mother and the child is well established. The cases of breast cancer goes down, the bonding of the mother and the child, and also the issues of, when you give other feeds, they are very expensive, and breast milk, a baby can get breast milk anytime as they so wish. So therefore, it's very important. The other thing I need to mention is that I need to encourage the breastfeeding mothers when it comes to breastfeeding, and then a mother feels like there's a bit of pain when they are breastfeeding the infant. They should remember that, they should know that it is encouraged that they should continue breastfeeding, because that is when the uterus starts to contract, and that is why they feel a bit of pain, because some of the mothers feel discouraged when that happens. Therefore, it is very important for them to remember that they should continue breastfeeding, because the uterus is supposed to contract and go back to the way it was before pregnancy. Therefore, it is very, very important for that to happen. Some of the implications are when an infant is not breastfed, in most cases you will find that they are given other types of feeds. And you see, the gastrointestinal tract or the stomach of the infant is usually not able to digest other foods except breast milk. Therefore, when you introduce some of these feeds, one of the things you expect is that there will be gastrointestinal inflammation, which causes disease. There is always some issues with constipation. You find that there is what you call as challenges with growth and development, and in all, you find that there is also the issue of stunting, which occurs as a result of an infant not getting what is sufficient, simply because the infant's gastrointestinal tract is usually unable to absorb the same. All in all, it's very important to know that even for other feeds, they should only get the other feeds after 180 days. We should introduce complementary feeding at the first day of the 7th month. It is very important for us to know that there are certain drugs which are still expressed through breast milk when a mother takes. For example, we discourage taking certain drugs, certain illegal drugs, and certain other drugs like alcohol when you're breastfeeding, because remember we said that when you're breastfeeding, whatever you're taking as a mother through maternal nutrition is what you still give to your infants. Therefore, it's important to note that for the time that you're breastfeeding, you really need to ensure that you check on your nutrition, and maybe if you are using some other drugs, you do away with them, because it's very important to note that whatever you take as a mother, you also give it to your infant.
Is Lilian Wanjiko, and I'm from Nyeri. Personally, I don't really have a problem breastfeeding in public. I don't find it a big deal, although it would be better if there were specific places designated for that. Lakini, I don't find it to be a challenge for me. Just ask someone for assistance. Mostly like the women in the market, they also know, because probably some of them have children and they understand the struggle. So if you ask for one of them, if I can use your area to feed, then they don't mind. I think it's important, because still it's not a very comfortable, because you get eyes, you get reactions from people, and it would be better if you could go somewhere where you feel comfortable, your child is comfortable, and you don't have to like constantly be covering them up completely so that you can feed them.